I'm Jordan Downey. I'm here to talk about the hepatitis A outbreak. One thing you should know about the hepatitis A is in the state of Kentucky, there has been many cases of the hepatitis A being in restaurants, especially in the food and the drink machines, especially. This case is not only in the state of Kentucky; it is in other states prior. They are facing the grief of hepatitis A. That is because the virus has become very common in people's society today because of the lack of washing your hands properly when using the toilet. Hepatitis A is very contagious. That causes liver infections. That is one of the main types that causes the liver to rupture and not be able to function anymore. Most doctors do not recommend treatments, but I would highly recommend that you get the procedure done, vaccination. Most people can catch the virus, often recover from the liver damage. Ways that hepatitis can spread, you can get it from especially nursing homes because of how people interact with the patients. Sexual intercourse interactions can spread hepatitis. Shaking a person's hand, using a glass, or drinking the same person. People coming into contact with one another sexually. Touching items that the person has already touched that already has the infection. Sexual practices often lead to the spreading of the germ. The infections can be severe. Drugs, alcohol, and other substances can be a cause of hepatitis. Who can get the virus? Laboratory workers can, because of when they're in the lab, they're trying to do research on hepatitis, and if something was to go wrong and they get it on their arm or something, then they have the virus automatically. People who travel out of state to other countries and other states, they can get the virus easily. Fast food restaurants can have the virus in the food or even on the drink machines. The outside environment, homeless people, because there's no way that they can go to the restroom on a daily basis and take a shower properly. Hepatitis can be a cause for all women, especially if they are pregnant. If that was the case, then the baby automatically has to have treatment prior to that. Then there's a severe risk that the baby will need to get immediate care. Take care of your surroundings in a hospital. Properly consume water. Do not use the same gloves. Properly clean the area around you. Keep the baby away from the virus, even if they have the vaccination, because even if you have the vaccination, you can always can get the virus once again. Men facing problems with the hepatitis A virus is substantial. Men having interactions with other females can get and pass the virus to the female. If men are involved in high-risk behaviors, such as interjection of drugs, drug paraphernalia, they can be caused by the blood sharing. It can be determined by the age you are. It can be in your system for several weeks, up to several months. The drug abuse and alcohol abuse, obesity, diabetes, unprotected sex, exposure to toxic chemicals like in the laboratory, people's fluids, and even tattoos and piercings can always cause hepatitis because the person that has the place does not use the proper equipment, and prior to that can be very severe, and it can be an abdominal gene in your family. Symptoms of the hepatitis A is loss of appetite, abdominal pain, bowel movements, nausea and vomiting, joint pain, itching. You can turn yellowish color. Your urine is very dark, and you often can faint and black out. Cures and medications for men and women. Starting with men, do not abuse alcohol. Yes, you can have a few drinks, but do not abuse that in any way. Avoid the risky behavior. Always have protection, clean. Get vaccinated, especially. Use your medications. And for women, same thing. Medication. Probably use the right materials during the pregnancy. Also vaccinations, and go through the process with breastfeeding your child. Maintain a healthy diet. Drink plenty of water. If there's any feedback that I need to have, if you have any questions, let me know. I would love to have positive feedback. Thank you very much.